Thank you all for Thank you, Julia. Thank you all for joining to what I did with my degree presented by the CUNY SPH Office of Career Services. So my name is Brian Couch. I'm in the MPH Public Health Nutrition track, only in my second semester part-time, so still fairly early in the program. And I'm also a student member of the current CUNY Career Services Academy 2025-2026 cohort. So tonight I'm joined by our co-moderator for the evening, Julia, who will be engaging with all of you in the chat today. And Julia, if you want to quickly introduce yourself.
Yes, thank you so much, Brian. Hi, everyone. My name is Julia. I'm a current SPH student here in the nutrition concentration, and this is my last semester here at CUNY SPH, so I'm very excited for today's panel and very excited to hear from our panelists.
Thank you, Julia. So tonight, as Julie mentioned, we're going to hear from two public health professionals who are CUNY SPH alumni and hold a Master of Public Health in Public Health Nutrition. They're going to speak to us about their professional experiences and share valuable tips and takeaways. Unfortunately, Allison Sosna will not be joining us tonight, but her contact information will be shared to you guys after the event for anybody who's interested in connecting with her. So before we begin the panel, I just want to give you all a brief description about the degree program. So the MPH in Public Health Nutrition, it prepares students to promote the nutritional well-being of population groups by learning to assess the nutritional needs of various populations, planning and implementing nutrition and food programs, and managing nutritional programs in community and institutional settings. So for more information on this degree program and others offered at CUNY SPH, you can visit the link that Julia will share in the chat. And for tonight's panel, you guys are going to hear moderated questions for our panelists, and then we'll have a Q&A segment where the panelists will get to hear from you all directly. And as a reminder to you all, you're able to visit the other breakout rooms at any time throughout the event. But until we reach the Q&A segment, we just ask if you guys could just use the chat to ask any questions or provide any comments. Great, now we'll move on to hear from our panelists. So good evening to Amelia and Veronica. We're excited to have you both here. I think it'll just be great to hear both of your perspectives as two people who've worked in the field for quite a while. So to get started, if you both could just introduce yourself to the audience, and we can start with Amelia.
Hi, everyone. My name is Amelia Chery. I'm a registered dietitian and I'm the clinical nutrition coordinator of the Adolescent Health Center at Mount Sinai. And I also have a small private practice, and I'm the founder of a website called nourisher.com, which is a resource for women and girls so that they can have positive relationships with food and body.
Thank you, Amelia. Veronica, if you'd like to introduce yourself.
Hi, I'm Veronica Chery. I am a 2019 graduate of the Public Health Nutrition program. I currently work for Anne Arundel County Public Schools, which is in Maryland. And in my role, briefly, I supervise 20 school cafeterias that I oversee. And so we receive federal funding to provide these meals to students. And so my overall arching role first is supervision, and then the day-to-day operations, menu planning, et cetera, for our school cafeterias to feed our 80,000 students.
Great, thank you both. So now that we know more about our panelists, we'll proceed with the moderated question segment. So this is a question for you both. It's just generally, why did you choose to pursue a graduate degree in public health nutrition? And we could start with Veronica.
So when I did first, I went to culinary school many, many moons ago, and I decided I wanted to be a chef. Once I went into culinary school, I realized that I wanted to do more than just work in restaurants and those types of things. And then I found out that Johnson & Wales has a program called Culinary Nutrition. And so basically it's a program where you're learning to cook, you're learning to cook, but with the health focus. And so at the time, and so this is in 2007, being vegan, vegetarian, it was kind of just emerging. And so I had a class, that was vegetarian cooking, spa cuisine, and so really focused on healthful eating. And so from there, I kind of got I wanted to do more of that, making food that tastes good but healthier. And so when it was at the time, I also wanted to do an RD. I wanted to become a registered dietitian. And so at that point, I spoke with one of my professors, and she was able to get me a volunteer opportunity at a hospital in the area, in Rhode Island. And so on Saturdays, I would volunteer in the kitchen with the RD, kind of learning what they did. But then I realized very quickly that I did not like that environment. I did not want to work in a hospital. I didn't want to do clinical. It just wasn't for me. And so I had to kind of rethink then what I wanted to do. And so when I came back to New York from, doing my undergrad, I found information about doing public health nutrition. And so I worked also in Harlem as a nutrition and cooking instructor at Harlem Children's Zone. And then I started working for New York City Public Schools in their food service department. And so all of those things kind of helped with shaping my mind and really solidifying that I wanted to do the public health nutrition track. And so then I decided to finally go through with it. And that's kind of how I got there.
I had worked for many years as a health and fitness and nutrition writer in women's magazines. And I decided it got really repetitive and like I wanted to work more with people one-on-one. So I decided I wanted to become a registered dietitian. At the time, you didn't need to have a master's degree. So I went right into the internship program. And I did work do clinical rotations through the hospital. It was really intense. I didn't love it, but I also did a rotation at some community clinics. At like the South Bronx Health Clinic was one that I really liked working at. So this was like 2015. So I knew coming down the pike, you were gonna have to have a master's if you were to be going to become an RD. So I wanted to get the master's. And I think I went for the MPH in nutrition instead of, you could also do like clinical nutrition, or pursue, there were other things I could have done, but I decided that since I like the community health so much, that this would be a better fit for me. And I should say, ironically now, which I didn't just say initially, like Veronica described, like what she does from a day to day, I actually do clinical counseling on a day-to-day basis. But I work in um, an outpatient center, and it's a different kind of environment. We're also grant funded in the particular clinic that I'm in. We're very community oriented. We serve underserved community, and there are definitely like many areas or ways to do clinical nutrition and counseling for sure. And sometimes I have to go inpatient and work in that environment, but that's probably like 5 or 10% of what I do. Yeah, so that's how I ended up. I kind of got pushed into the MPH because it's required now, but that's how I decided on this particular program.
Thank you both. The next question, it's for Veronica. And Veronica, I think you might have touched on this a little bit in your initial answer on why you chose to pursue the MPH, but how do your skills as a trained chef translate to the public health sector, specifically in your current role? And how has your culinary training helped you connect with the community or address a public health challenge in a unique way?
And so with my culinary degree, like I said, my day-to-day is supervising our cafeteria. So I manage 20 people plus their staff. So altogether, it's almost like 50 people. But one of my roles that I do is recipe development. And so that is also a big challenge because we have regulations in what we can produce in our meals. So the federal government, so we get funded through the USDA. And so the USDA gives the state money. The state then gives us money based on the number of meals that we serve for the previous month. So we're always a month behind. And so the federal government, the USDA, dictates to us how much sodium, how much sugar, how much fat, et cetera, can be in our products. And so with these regulations, it's our job then to figure out how do we make a meal for our students that's under $3.50, that includes a milk, that tastes good, looks good, but still meets those regulations. And so that is where some of my training comes in, figuring out how to provide those meals within those limits that students actually want to eat. And of course, you don't get 100, we don't get 100% all the time. There are, things that students love that we have on our menu that is a hit. There are things that, are not a hit. And so we really try to make sure the menu is, sound, nutritionally sound always, but still appeals to the student and still check some of the boxes for parents because parents have their own ideas of what they think their kids should be eating. And then the kids have their own idea of what they think they want to eat. And then trying to find that sort of middle ground, it is tricky. I think later on there's a question about projects, but I'm also utilizing my culinary skill to make modified menus. So we have students that have that have texture modifications that they need, puree, minced moist, chopped. And so the puree has been definitely a challenge for us. But with my background, I've been able to create recipes, like legit recipes that we taste because our boss tasked us with also eating these purees. So not just making sure that the consistency is good, but it looks good and it tastes good. Because, even though some of our students may have the texture issue, they are still able to taste. And so it should still taste good and it shouldn't just be anything put together, blended. And so that's one of the things also that I've really been working on as part of, utilizing that nutrition and culinary background together.
Thank you, Veronica. Next question's for Amelia. Amelia, in what ways has your MPH training supported your entrepreneurial work? And what advice would you give to someone who's passionate about both advocacy and public health, but isn't quite sure how to bring those interests together or where to start?
I think that my MPH just really gave me a lot of confidence to push through with things, to be perfectly honest. Like, I wrote a book. I would go on social media often and talk about things that were important to me. And I think having that advanced degree just helped me push through like a lot of imposter syndrome with a lot of these things I wanted to tackle. It helps me as well, just really in terms of my advocacy work, I do a lot of work with eating disorder prevention. So really understanding sort of like the top-down view of like what are some of the factors that are really contributing to problems like eating disorders, which are on the rise significantly since COVID. It's just been really, really helpful as opposed to coming in from the underneath, which I would consider really like the kind of the weeds of like how do we get this person renourished, which is definitely important when someone's medically unstable, but when they're just out there walking around in the world going through their daily life and they have a lot of disordered habits, a lot of stress around food, that's something that's really important and I think impacts even a much greater number of people. And I think the public health, like the broad view of what are the issues in our system that cause this kinds of problems that people are facing has been really, really helpful in a way that if I had done more of like like a clinical degree, I'm not sure I would have gotten. Um, and I know there was a second part to the question, I think, which is about my entrepreneurial work. Can you repeat that? I'm
Yeah, no problem. The
sorry.
second part was just about like, do you have any advice for someone who's passionate about advocacy and public health and how they could bring those interests together?
I mean, I can't say specifically the sky's the limit, but I think that if you have something that, if there is an aspect of nutrition, or your public health work that you're really passionate about, um, my advice would be just to like try to get as close to that problem as you can, as close to people who are dealing with it. Because, before I worked as, a dietitian really counseling people one on one. I don't think I really, what I read in a book about how to help them become more well nourished is a lot different than being faced with a person and hearing like what's going on with them every single day in terms of how they're being confronted with food, or thoughts, ideas, of beliefs about food. So if there's something you're passionate about, just really getting really close to people who are struggling with it, I think will help you so much in terms of how effective you can be when it comes to coming up with solutions. I'm not sure if that's helpful or not, but that's my advice.
No, thank you, Amelia. That was definitely helpful. And I feel like both your responses are super insightful. And it's just interesting hearing like I guess Veronica, you're more in the school setting and Amelia, you're more in the clinical setting, but there's still some like overarching themes that cross over between both of you doing. So I think it's helpful for everybody here for sure. The next question we had, it's for both of you. So whomever wants to answer first could go, but this one's just what is the most rewarding and challenging part of your work? And what gaps do you see in the current public health workforce? And how do you think emerging professionals can help close those gaps?
I can go first. Um, I think, well, one of the most challenging things obviously in my work is we feed students. We fuel our students with breakfast, lunch, and some of our students also get a dinner meal from us. And so, you know, when you're in school, you have limited options, and it's great for us to see year to year our participation increasing. And so that tells us that we're doing something right, because we're constantly trying to engage with our students, get their feedback for what they want on the menu, working with them, to ensure, and it's part of the regulation also, we have to get student feedback before we're able to add something to the menu. And so we do tastings with students. We have a student board. We have a student that is assigned to our department that gives us feedback. So it's, a good relationship that we have. And so in our school district, we really do try. And of course, one of the most challenging parts of our job is one, you see these students every day. And so as much as we try to change the menu, do cycles, sometimes things can get monotonous. The other part of it is the regulations. The regulations do get tight. They're even think they're We have a goal right now with sodium, and I believe we're at the lower level. But there are school districts that are still working their way down in terms of cutting sodium. So, in terms of sodium, it's very minimal. And so some of that takes out, unfortunately, some of the flavor it just does of what people are used to. And like I said before, you have different views. You have the kids, you have parents, you have the wider community, you have the legislators that all have opinions about school meals. School meals becomes a very big topic all the time. I remember when Eric Adams first came into office and he had this whole thing about chocolate milk. And I felt like writing an op-ed, and I should have, about chocolate milk. It's like, what is in chocolate milk? Like, why do people get so crazy about this? And it's like, because it's the low hanging fruit, and they can get it, right? It's like you have all these other issues in New York City, and you want to make your first 30 days about removing chocolate milk in schools. When naturally milk has its own sugar, and the chocolate milk that the extra chocolate and sugar that's added is so minimal. It's just like beyond, but it's just the opinions and the, perspective of people that really makes the job harder, because you just have so many stakeholders that you have to keep happy. And like I said, you're only gonna be able to do maybe 75% if you're lucky, um, of the time a good job. And then, of course, the other times people are going to complain. And I think in public health, you just have to know that is sometimes part of it. You're not going to make everyone happy.
I think everything Veronica's saying is so interesting and like also in contrast to my work. I think people's opinions are very, very challenging when it comes to nutrition. Just talking about school lunch, I don't even work in a school at all. And I've gotten emails from people I know that are like, oh, look at this article from like Sweden about their school lunch and like how great it is. Why can't we do that in New York? And I'm like, oh my gosh, where do I start? Like they don't have $1.50 a meal to spend. Like there's just and the so yeah, you have a hard job. And opinion plays into I think it will play a role in your job in any nutrition field because everyone is has their own thoughts and ideas about nutrition. We're confronted with food every single day, and there's so many people out there talking about it. And I recommend chocolate milk to my patients all the time. And it is a heavy lift. They think it's really bad. And I mean, that's a very small like example, but chocolate milk is a great thing to drink, especially when so many kids aren't getting enough calcium and vitamin D and protein. So it's funny that again, like I like how Veronica said it's like a low-hanging fruit because I often wonder like, why are they still focused on this thing? And it's like legislators, but it's also like it's parents and like then the kids get afraid to drink it or they feel guilty and it just becomes like very complicated. And that's a challenging part of my job, working with like thoughts, beliefs about food that are just unfounded and are actually like really harming kids in particular and young adults as they start to like have more control over their own food choices and they're just like really confused about everything. One of the things I had planned to talk about though was the one of the challenges of working within the medical model, I guess, is we're pushing back against things like weight stigma and how we've been thinking about issues with weight, obesity, overweight, and things like that. Because within the medical model, it's seen as a disease that we need to treat. And we know that approaching it that way causes a lot of harms to our patients. But that's a paradigm that's been around forever. And I'm pushing back against something that is things that a lot of the doctors have been working within for years, many, many years. So that's that's a big challenge, but something I'm passionate about discussing. I've given in services about weight stigma to other medical professionals, and just of course working on it one-on-one with patients about is their weight like really a problem? Is it more like a cultural issue that's causing them the stress and like, hey, by the way, like your health is actually in great shape and how can we kind of reconfigure like the way they've been thinking about themselves so they actually can move forward and like eat well, get the nutrients that they need instead of feeling bad about it or restricting. Um, Yes, sorry, I forgot. That was the question. What's the biggest challenge, right? And then what's um, like the best part or the most gratifying, I think you asked?
Yeah.
Um, for me, it's just really seeing patients like, which right now is like a lot of young adults just like really, making changes, like not necessarily even to their eating, but the way that they're thinking about things. So like kind of embracing a new thought pattern around their food so that they can go ahead and like, hey, yeah, making time to actually make a snack to bring to my college this week, or this day is actually a really good type of self-care instead of like, oh, that's not important. I just have to get there in time. And like, or maybe I shouldn't eat it all because by the way, my body is this size or I want to look like that. And like when people really embrace it and can start taking steps to take better care of themselves with food, that's like extremely rewarding. And I feel like it's something that they can use as they go on, as they continue to grow. And I always point out, like, one day you're going to be a professional, you're going to have a job, and these things are all still going to be really important. So, it hopefully lasts for them.
Thank you both for a super, I feel like very insightful response. I feel like my head's like I have probably questions I might want to ask you both after this. Next question's again for both of you. It's just a general question on do you guys have any job search tips for those who are currently seeking employment in public health, especially since there might be, people who haven't decided to pursue the program yet in this call or might be in the beginning of it, would be helpful to hear.
So I moved to Maryland, and I was living in New York at the time. So I would say for one, be open to maybe moving somewhere if you find a job that you really like that pays, what you want. And so with the degree, I was able to get a nice increase in pay when I did take my current role. And so of course that made the move a little bit sweeter. But being open to moving, and if moving is not an option, be open to um, just looking at different aspects of nutrition, maybe something that you haven't thought about. Like when I was doing my searches, I would put in school nutrition, and so those types of jobs would pop up. And so, maybe you're interested in um, policy or anything like that. And also apply for jobs that maybe you don't think you're qualified for, or a job that you think maybe doesn't even pay as well. There was a girl in my job who left us and she went to get a different job, but she, applied for this position, interviewed, got it, and she negotiated like a 50% increase in pay. Um, and I mean, she's qualified. She has a lot of, she had the experience. She has a master's and all of that. And so she negotiated the heck out of those people, and they gave her a 50% increase from what was actually posted on the website. So, don't be afraid to negotiate as well. And if it doesn't work, it doesn't work. And if you take it just because you want the experience, that's fine. But also feel empowered if you have the experience to ask for more.
I could take a lesson on negotiating. I think that person must have some really great skills because that's a whole nother aspect, right? Of like accepting a job even once you find one that you are interested in. Um, my recommendation for looking for jobs is just to think about every single contact that you have and reaching out to them as opposed to going through, HR. And I'm sure you guys probably know that already. But I think sometimes when we're really maybe desperate or like throwing things against the wall, like we do tend to like, well, I do, I'll speak for myself, go online and start doing a lot of research and looking for things. But I've never gotten a job that way. Every way has been like through someone that I've that has asked me or that I've known and told them, hey, I'm looking, or hey, I'm really interested in exploring X, striking up a conversation with someone. So kind of just think of creatively about every single person that you're connected to and be willing to reach out to them. I think also just a general rule is to always think about how you can help the person too, or compliment them. People love compliments and it kind of pricks their ears like, hey, I saw you doing X. I love that. Um, it just kind of gets a conversation going instead of leading with maybe a feeling like I really need a job. How can this person help me? Just walking into it thinking like, oh, maybe what could I do to help them or what they need that I could provide. Then right off the bat, and you guys have tons of things you could provide. If it's not clear to you, reach out to one of us and ask. We can help you with that. But that is a way then the person's just looking at you differently. Like, oh, this person's like really helpful. And like, what would it be like to have them, on my team? That's just kind of tweaking your thinking a little bit when you do approach people.
And I will say, depending on the job that you might want, or if there's someone that you maybe admire their work, maybe looking at their track and seeing what types of jobs they've had, could kind of start steering you in a direction that you may want. I thought I would work for WIC when I got out of school years ago, even when I had my undergrad. And I have since never worked for WIC. I interviewed with them before, but it just never worked out. And so yeah, I just thought I was gonna leave school, go work for WIC, and just be, helping moms with getting WIC. And that wasn't the case at all. I did something, within child nutrition, but just a little bit different.
Yeah, I think like the way you get a job, and if people have more specific questions, like we could definitely answer, but is so the way you get a job or a job that's great for you is so unclear. So being really open-minded about it, like the position I have right now, my position at Mount Sinai, which I love, I actually applied for several times over a couple years and never heard back. And I'd already been an employee of Mount Sinai in the past, so I thought for sure I'm assuming they'll at least interview me. And they never did. They never called me. And I'll tell you a story how I did get the job if anyone's interested, but I did definitely came in through like a back way. And it was more, I mean, it all worked out well because I did some other things in the interim that made me even more prepared for this. But my point is just that you can't really predict the path, so be really open-minded and also if you apply for something and you don't get it, don't assume anything. You have no idea if like why. If you do have an opportunity to talk to the person, of course, just be curious and ask questions so you can get some information and insight. But in the absence of being able to talk to that person, never, ever assume that you know the reasons why you didn't get it or they didn't contact you for sure. So it will keep you motivated to remember that, which is the truth. You don't know what's going on there.
Thank you both. I feel like the next question is fitting based on some of the experiences you both shared about like thinking that you were gonna apply to one job and then it not working out and being able to pivot from there and move forward. This question it's can you tell us about a time that when you've been rejected for a job or opportunity and what you learned from that experience and I guess how you grew from that experience? And Amelia, I don't know if you want to start because I feel like you were sort of like on the track to explain that
I
anecdote.
can start because I've been through tons and tons of rejections. I think that's like you have to just be open to getting rejected over and over. And not just for jobs, I've pitched book proposals and got rejected. I've had so many things that um I think a lot of rejections means you're doing the right thing because you're trying a lot. Um, what is the question? How to recover from a rejection or?
I guess just like what how you learn from the experience. And yeah, I guess like that the way you phrase it's like how you recovered from it, how you grew from it, I guess what you did following it to get to where you got to now.
Mhm. Um, I think one of the things I just mentioned were don't get down and under think that, okay, I'm not like I wanted this role. I wanted to work in adolescent health, but I had no adolescent health experience. I had pediatric experience, but adolescent health is like a specialty within pediatrics. I also wanted to do eating disorders, but I didn't, it's one of those catch-22s where you can't do eating disorders unless you have a lot of eating disorder experience. So I think going, I guess, I mean, I want to say something really cliche, like don't give up, like you don't know the avenue and like keep going. But that, I mean, really is kind of, kind of it. I mean, I think that recovering from rejection is like a really good skill to build. Just understanding that it is a reflection of you. You don't know what factors are at play, and that there are many, many routes to get where you're going. So like you just keep trying. And also, again, we keep saying so being open-minded because I ended up getting this position, but I could never have predicted that that position I did accept would have been like the best route in here. Like it couldn't have been planned better if I had just stepped into the role without doing X first, then I don't think it would have, there would have been some lingering on things like going on in the back of my mind about what was right and wrong, like in terms of other experiences I've had. So the way it worked out was really well, and I could never have like planned it or predicted it.
Yeah, I agree with Amelia. And I think rejection sucks. You know, you're gonna send applications. I sent applications out. I did interviews, multiple interviews, and then you know you get the email. You didn't get it. You didn't get it. Every so often I would email back and just say, hey, is there anything that I can work on? In the future, you know, if I do get an interview again. And one person emailed me back and just said kind of they went with an internal candidate. And I will say, even from my experience, especially with city county jobs, they do tend to go to, it's not always impossible because I came from the outside, but sometimes internal candidates do um, get preferential treatments. So sometimes it's nothing that you did. It's mandatory to post positions, so they have to post it. You have to do interviews. They kind of have to go through the process, even though sometimes they know internal candidate might get it. I mean, I'm just being honest, but they do have to go through the steps. You know, so just keep applying. And sometimes a position that you see open, you know, might go back open. Um, I know when I got hired for the position I have, there were four of us that started within, I think, 2 years of each other. And so, you know, my partner who I work with, she came on board. I started like a year later, and then someone else left. And like right now, we're kind of in a groove and we have our team now. But, you know, one person moved and did different things. And so, you know, you just have to keep looking, applying, and then be intentional with the applying as well. And maybe do some volunteering depending on what your role, what you're looking for. Maybe you just need to volunteer a little bit more, join an organization, um, get connected with people so that way you're able to you know, get your foot in the door. I know in Maryland, our school nutrition directors are all kind of close because our state, the Department of Education, does a lot of in-person training. Um, and so if there is an opportunity to be a part of some of that, you know, we have um, legislative groups that come together to help to do some of our legislative things in the state. So there's different ways to get involved. And so maybe while you're in school, thinking of ways to get involved before you start applying as well.
Thank you both. I think this question kind of can branch off what you just mentioned at the end, Veronica, and I think we have time for one more question before we open the Q&A, but this question, it's again, either of you could answer. It's what student opportunities or resources did you take advantage when you were at CUNY SPH, and how do you feel like those helped you in your career? or I guess in your just general experience?
So like I shared with you guys, but I'll share with everyone. When I started, it was brand new. And so I think now there's more going on. And I don't know if I took full advantage, honestly, of everything that was going on. I believe I definitely took advantage of the career services, any tutoring that was happening, that I was able to fit in. But I know I used to get emails. I'll say what I saw. There were, lots of different people going to protests or marches or, getting together for a cause. I did see a lot of that. And I know people did participate in it. I worked a full-time job, and two side hustles and full-time schooling. And so that is one thing that I wish I did do more of is take advantage of more school activities. And so for people, anyone who's on the call, the video tonight, I would say, definitely find ways to get more involved and because you only get that experience once. And even though you are busy, we're all busy, try to find the time, would be my advice.
Um, I also was really busy when I was doing my MPH. I had young kids and I was working, so I didn't do many things. But one thing that was really helpful and interesting was there were a lot of other people who were actually working in public health who were also, working at the DOE or like doing things that had a lot of experience. Maybe they didn't have their MPH, but they had a lot of different jobs and just talking to them before, after class, if you do any classes in person or you ever do chat like on a Zoom during class afterwards, was a good like really eye-opening and like an interesting like just you get to meet other people who are professionals even if they're not haven't finished their degree and it opens your mind up to like different types of jobs. I was telling Brian before we all opened this up that one thing I did really take advantage of was like tutoring in class for my some of the I'm not sure if it was biostats or epidemiology, but there was one class that was really challenging, and there was a tutoring session which I learned halfway through the semester, like right on a different floor, right after my class. And going to that made the class like 100 times easier. So if there are any opportunities like that, you can just make things, it's like having one person helping you with like whatever your questions are, which is a lot easier to ask than I know sometimes when I was in class, I'm like, I'm gonna ask, but then class is rushed, and at the end, you just want to like leave or get off the Zoom. But if there is a tutor and you need some help, definitely take advantage of it because once you get out in the real world, there are fewer people to ask.
Thank you both. I feel like one sentiment that you both shared, I feel like in a lot of your responses was on just being open-minded about like navigating the field. I really agree with. I feel I only have my undergrad in public health since I'm currently pursuing the master's, but I feel like all the jobs I had so far, I didn't even know that the title existed until I got it, and it's really exposed me to a lot of interesting work. So I feel like I don't know, from my perspective in public health, it's good to go and not having maybe like a super specific title in mind, but kind of maybe having concepts in mind and seeing where you can fit in. So I feel like the information you guys shared a lot was really helpful and reassuring. I think we're a couple minutes towards Q&A. Maybe we can squeeze in one last question for you both. I think this one, and again, it might tie into some of the information you both already shared, but do you have any advice for those who have little to no experience in public health as they begin their degree or if as they consider going back to school, like any nuggets of advice you'd share to people in that particular boat?
I think with public health, I feel like you can start somewhere with very little experience, as long as you have an interest and you're, wanting to help people, because ultimately that's what we're in public health to do. There are tons of different jobs in all different capacities. So I have a heart to help people. And there are lots of jobs. And then especially entry level, and then you can get into something, learn about it. And like I said, when I did that volunteer opportunity at the hospital, for me, that's kind of where I got that like, oh no, this is not what I like. And had I not had that experience, maybe I would have got a job in a hospital, and then I'd been like, ooh, you know, maybe I would have liked it. Who knew? But um, have those different experiences, um, I think is my advice. And like I said, in public health, you can start with all different types of positions. I feel like with little experience, um, and learn more about whatever that niche is, and maybe then grow into it.
I was gonna say just like read the news. That's something you could do like every day, just and find things like talking about advocacy or just where you might want to put your energy, like reading a lot of from a lot of different sources so that you could see like what some of like the issues are that our country's facing, and individuals as well. There's micro and macro, but just staying on top of things. I think that's like a really good way too when you walk into interviews to maybe connect with someone or impress them. Like you're aware. You're not just trying to get a job, but like you're aware of the broader picture and like can give context to different situations, be like well-rounded. I think that that's a good thing to kind of spend a little time, especially if you're, on your phone, like, getting some of those things in your news feed so that you're aware. You're, obviously interested in public health, so you probably love some of those articles and things.
Thank you both. I think at this point we can open it up to audience Q&A. So if anybody has any questions, you could feel free to use the raise hand feature and ask aloud, or if you feel more comfortable putting in the chat, Julie can read out your question. But yeah, well, I'll pause here, and if anybody has anything they'd like to ask our panelists, please feel free to let us know at this time.
I'd just like to say that I would love to hear questions from people, because I think I want to speak for Veronica, but like I don't really know who we're speaking to, and it would be probably a lot more helpful if you just really ask like very specific question that you have. I think we'll both be happy to answer.
Hi, um, my name's Anna. I just wanted to ask, like, more specifically what a day to day. I know you mentioned kind of what you do in your day to day, but if you could give a more detailed description of like what your day to day looks like and maybe what are some of your like pros and cons with that. Because it's kind of something hard about public health is that the every position is so specific that when you're looking online at different careers and different options, it's hard to know exactly what your life is going to look like in that job. So, yeah.
I'm not sure if you were speaking to Veronica or myself. Did you want us both to go?
Yeah, that'd be great if you could both respond.
Okay. Well, my day to day right now, so I work 3 days a week at Mount Sinai, and then I work 2 days a week for myself. So when I'm at the hospital, I basically come in ahead of the day. I'm already looking. I have one-on-one counseling sessions with patients all day. So I'm looking, reading their notes, seeing who referred them, what's going on with them medically, maybe read the social worker's note. And then I see them and I talk to them and we work on like whatever particular nutritional issues that they're having, and we set goals. And then we talk about when they're going to come back. And then if there are significant issues, I'll also reach out to other people on their medical team um, to talk about how to move forward. In this role, I've also had some I've had the ability actually from my MPH, I learned how to create like a quality improvement project. So there are issues with how we are working with our eating disorder patients in this particular clinic. So I've pitched a project about how we can improve our eating disorder care. So that's something I work on in between patients, or if I have like a no-show. Actually, my role here is going to be expanding in January, so there's going to be another day added so that I will have time to work on that. That would be like a completely different, it's more about leadership and project management, which would be totally different than day-to-day care. I also participate in rounds. So like we have a meeting with the Eating Disorder Center in particular is one that I go to where we actually talk about like problem solving for particular cases that are challenging. On my 2 days away from here, I see some patients private practice. They're patients that are referred to me from pediatricians that I know. I used to do that a lot more, and I've dwindled that down. That was a learning experience for me. I really wanted to do private practice, and I left Sinai for a little while. And I found that to be really challenging. That comes with knowing yourself, the marketing of it, and the keeping up with all the different aspects of like getting clients, referring back to doctors, and keeping up with they're more clients, so they're coming of their own volition. Whereas in the hospital or in this clinic, the doctor's referring and pressuring them, go see the nutritionist. It's a lot different. Um, it's just a different dynamic. And I personally realize that I don't have the skills that it takes to be extremely organized and do my marketing one day and like, my get on Instagram every day and all the things that have to be done. But anyway, I do still have a lot of referrals. So if patients are reaching out to me, I will see them on a Thursday or Friday. And they also have my a book that I wrote that I still do publicity for, and a website where I write about issues that are very, very specific to women and girls, because that's something that I personally am passionate about. That's pretty much my day. At the end of the day, or in between patients, I write up all my notes. So there's time on the computer, there's time face to face with patients, and there's time with other people on the patient's medical team. And some people as RDs do that all day long, 5 days a week, and they don't have the 2 days where they do their own projects. For me, that's just too intense to just see patients all day, every day. And there's also RDs that do that all day, every day in the hospital, which is a much more acute situation. And that was just like trial and error, figuring out like what worked for me. And again, like what I was good at. And that I think just comes with, unfortunately, that's why I don't think career path is that straightforward. It comes with kind of knowing yourself and putting yourself in different situations and seeing how things feel. But there's always flexibility. Like I have over the years turned this situation into something that works for me. That's always an option for everyone. Um, yeah,
Thank you.
you're welcome.
So my day to day, so like I said, the biggest part of my job is managing staff, and so working with the school district, one of the pluses is that my schedule is pretty much straightforward, Monday through Friday. I don't work weekends. Um, I get off by 4:00. Yeah, 4 o'clock. I get off at 4 o'clock. Um, we have holidays and all that's good stuff. Um, and so my day to day is managing staff, a large portion of it, ensuring that my schools are staffed, ensuring that they have what they need, et cetera. They order their own food and stuff like that. Some of my work involves talking with school administration, principals, community managers, they call them. They have 10,000 programs in their schools for after schools, communicating with them about meals for after schools. Um, some of my conversations with parents talking about allergies. In our department, we have 3 registered dietitians on our staff. And so we're paired up. So I am a business manager and I have a RD that's my partner. And so I do a lot of the recipe development, and then my partner will do the nutrition analysis on menu. Um, Legislative work we do as well. And so our office is in Annapolis, which is the capital of Maryland, which is where the governor's office is. And so sometimes there are town hall meetings that we go to. One of our topics right now, obviously, is universal free meals. So in New York City, New York City has universal free meals for students. Most states do not. Maryland is one of those states that does not have universal free meals for all students. So that is one thing that we are pushing with the governor to try and get that passed. I go to conferences every once in a while. So like I said, the Maryland Department of Education, our food and nutrition department within the MSD group, they do hold a lot of trainings. So we have quarterly trainings that we attend, meetings online. We have some in person, like we have one coming up in December where we'll get together with other school nutrition, nutrition staff from the state. We come together, we learn about new topics, whatever's going on in our state, depending on funding, um, because all our money comes from the federal government. We have to ensure that we're appropriating, we're using the funds appropriately. Anything that's changing, there's a lot happening in terms of changes. There's talks of a lot of things that are going to change. Nothing has been signed yet, but in the current administration, there are some things that are in talk. So we got together actually last week to go over some of those things. So, like I said, a large portion of it is, and that's like things that happen over, let's say, a course of a month, a couple months. But my day to day is managing staff. I don't do like their payroll or anything, but making sure that they have those things done, making sure we have coverage. Staffing is a big problem in our district and in many districts, school districts. After COVID, we lost a lot of staff. And so that has been a big challenge. So figuring out how to get new staff, doing job fairs, and those types of things as well. Hopefully that was enough.
Yeah, thank you.
Thank you both, and thank you, Anna, for that's a great question. I think I think some time for some more. If anybody else wants to unmute or send a question in the chat, please let us know.
I have a question.
Sure.
Hi, I'm Allison. I'm a senior undergrad in San Diego right now. But my question was, this could be for anybody, but do you see a lot of room for people to get involved in public health nutrition who maybe like aren't on an RDN track or have like those nutrition undergraduate classes as background? Because like I know for myself, I used to want to get like RDN certified, but I found myself in public health and I really love it because of how many people it's able to impact, but I still have that attachment to nutrition in that aspect of it. So I was just wondering, like, how strongly do you recommend that background, or if it has any impact?
I don't think I heard what you said in terms of it just general public health nutrition, or are you trying to do something specific?
Um, Pretty much just about going into public health nutrition without um being a nutrition undergraduate. Yeah.
Yeah, I think so. I think from my experience, Amelia might say something different. I find if you do public health nutrition, in my experience, you're either going to be in operations, so that's running some sort of program. So that could be seniors. So like across from our office is our senior department. And I also had applied for them before I got the job that I have, um, because they provide meals to seniors. Um, you know, Seniors can come in person to eat or they deliver to them. So that's an avenue as well. So I find either you're like in operations, or some sort of maybe policy could work. So So the young lady from our job who I was telling you about, she works for the organization is called FRAC, and they do a lot of and I can't remember what the acronyms mean right now, but FRAC. They do a lot of like policy research. They do a lot of reports, lots of information about SNAP, and what happens, when benefits are cut. And so, especially in this climate with a lot going on with benefits, meal benefits, and those things, that's an avenue to learn more about that and figure out how maybe you want to help those who need those benefits or who are impacted by those benefits. I believe Allison, who was going to be on the call, she and I graduated in the same year. She used to work for Central Kitchen in DC. I believe it's called Central Kitchen. And they do a lot of food pantries. And so there are different avenues, and you don't have to be in an office. So my job is sometimes in an office, sometimes it's in the kitchen in the school. And so you don't have to necessarily be just in an office. There are other positions where you can be more in the field if that's what you want to do. But yeah, food banks, food organizations, food insecurity organizations, or like Amelia, if you want to do more of helping individuals. If you want to teach, there are programs where you're teaching nutrition, teaching culinary. So there's lots of different avenues and different populations that you could be with, right? Kids, adults, elderly, and within those different age groups, there's different avenues. And so I think, maybe figure out what you're super interested in, and then going, through the different parts of the different age groups and then seeing how you can lend your, services.
Yeah, I think Veronica did a really good job explaining. I mean, I think any kind of there's so many nutrition programs around the country, and they need so much help. Like from a leadership level, they don't necessarily need a dietitian. That's really the person that gets in the weeds of things, like nutritionally speaking, or does counseling. But that is not there's so much more work to do from on a bigger level that I definitely think there's opportunity for you for sure. And I was also thinking one thing Veronica didn't mention, I was thinking of jobs in consumer, like in companies that are food based that need people to do marketing and all kinds of if you're interested in business or marketing communications or any of those things, and not necessarily like community health or programs, like that's another place that an MPH would like really help you stand out if it happens to be like a food based company, which as we know, they're more and more popping up every single day. Yeah, I think there's tons of opportunity.
Thank you. That's really helpful.
We do have another question in the chat. So we wanted to ask, are there any courses or certifications or other learnings that you would recommend to increase nutrition skills?
I don't have like a broad class that I would recommend, but if whoever asked question like has a specific niche that they're interested in, maybe I could help. But I think you have to be a little careful with nutrition classes or certifications and things that promise to make you a nutritionist and things like that. Just sometimes is the information they share, but also what are you going to do with it? Where are you going with it and what do you want to do? Because certain ones, I think that the RD allows you to do very specific type of work. And then if you're just trying to broaden your knowledge on like general nutrition, that there's probably like some great classes I've seen a few advertised from like large universities actually. But they're not part of matriculation. They're just something you pay for. Um, yeah, sorry, Veronica, did you have a thought?
Not particularly, like you said, like if it's specific to something, like even in child nutrition, there are courses that I could have taken. I haven't, that deal with school nutrition. So there are things that are available with us because we are federally funded. We do have to do a certain number of hours of continuing education. And so, we just utilize a program that our company pays for. And so, yeah, unless you're maybe organizations, if you want to join something, but maybe the company you work for can pay for certain programs that you might be interested in. If you have to, like I said, do continuing education, I'm sure Amelia has to do some as well for her RD. Unless, but no, I don't have any like specific thing.
I mean, yeah, I have to do like mandatory continuing education. And I think in like a 5-year cycle, and it's quite a bit, and it's actually really, really helpful because there's new things coming out all the time. So there's definitely courses out there. I think it would, if there's something very specific you're trying to learn, like I just did like a GLP-1 in eating disorder, and then there's like there's very specific things if you want I think you're welcome to take any kind of CEU course on that. You might just ask ahead of time whoever is selling it or offering it to make sure that it's not like above, it's super clinical if you just want like a base knowledge, for example. But I don't think there's any like one class that's gonna like cover everything. I think, do you still do like life cycle nutrition as part of the master's? That was like one of my favorite classes to this day.
Yes.
I love that. I think you learn a lot in there, and it could tell you where you might want to drill down and get kind of like, oh, this is an issue for this age group. What more is there to learn?
Thank you both. And yeah, I took that class my first semester. Amelia and I agreed that it was like I feel like it was the best way to start off in the program because it gives like the most broad overview of it. Um, I think we're just about to come up on time. So if there are any questions, I believe that anyone who attended will get contact information of our panelists to ask anything you may have not had a chance to tonight. So just to close out, I just want to thank Amelia and Veronica again for being here. I thought just all the information you shared was super insightful. I'm sure everyone who attended thought the same thing. Just to close this out, if you guys, if either of you or both of you have like just one last takeaway you'd like to share, one last word of advice you'd like to share to the group, please feel free to let us know.
I just had a quick last question, if you don't mind. I was just going to ask Amelia the title of your book and what it's about.
Sure, yeah. It's called Diet Proof Your Daughter. And it is about, it actually grew out of my capstone, which was about how whether parental food talk, or the way basically parents talk to kids about food, has an impact on their BMI and their eating behaviors. And I put BMI in there because it was something that was easy to measure, not necessarily because that was the thing I was most interested in. And it basically, what I saw a lot, which is what I was saying about getting really close to the problem, so you can kind of really understand what people are struggling with. Um, when I worked in pediatric endocrinology, where I was for about 5 years, I saw a lot of parents struggling with how to talk about health, quote unquote, healthy eating with their children. And then it was also the waters got really murky or mucked up because they were already in pediatric endocrinology, so they probably were referred because their child was at a specific BMI percentile, and then the doctors were concerned. So there was already like a lot of stress and pressure around eating. Also, we dealt with growth with kids, so there was a lot of kids who were underweight, and we were putting a microscope. Whenever we put a microscope up to the way kids eat, we have to be really careful because there's just so much pressure. And I'm sure Veronica knows, working with kids, like um anyway, I think that it requires a lot of nuance and care when we're talking to kids, and parents actually need a lot of support around it, and they need help sort of filtering out all of that noise from the medical community, from culture, from social media, from the news cycle, which is always pushing, the latest study just to get hits and things like that. So the book is meant to support parents and women, moms in particular. And yeah, it grew out of first my interest, which I pursued through my capstone, and then just all this experience kind of seeing like what parents were like coming up against, especially in the context of like, okay, well, my kid is at a higher BMI or they are at a lower BMI, and like food is an issue. It's not easy for me to say, oh, just eat what you want. That's what it's about. Um, yeah, and we were talking about rejection before. I got rejected quite a few times with my book proposal. But I remember really interesting when I went down that road, they were saying people who were working publishing were saying you need about 100 rejections to get a yes. So that was like it was a good meter, a measure just to remember so that, you kind of have to think, okay, I got to collect 100 rejections before I'm ready to quit. It's probably same with, job searching and things like that. It wasn't that, okay, I sent it out to 5 people and I got rejected. So maybe this isn't right, right for me. And the short part of that story is I actually ended up quitting the process really quickly and decided I was very impatient. So I decided to self-publish the book, which was is a whole nother conversation. But yeah, that's the title, Diet Proof Your Daughter. Thanks for asking. If anyone wants a copy, I can make them available somehow. I could do electronic, like a version, or if you have questions about writing or something like that too. Happy to help.
Thank you.
And I was just gonna say, because Brian, you asked, just in closing, um, it for me, it was a blur. I mean, I think just try to enjoy as much as you can, the experience of school. It is, it does get challenging. It does feel like a lot. There is an ending point. It doesn't go on forever. Of course, when you're in it, in the weeds, and you're having the deadlines and all these things, it seems like, um, it just will crush you. But there is an end that, there is the light at the end of the tunnel is there. You just have to keep going, and you'll get through it.
I agree with Veronica. I was kind of reflecting on like what a blur. I couldn't like remember a lot of it, but I was reflecting on it in kind of advance of doing this, and I was remembering. It's quite a while ago, but I was like nursing my baby, studying for my test, being like, what does it all mean? Let me just burn this down. What am I doing? And like those questions came up over and over. And I'm so glad that you will get through it. And I'm glad that I stuck with it. And you never know what is going to happen. Like I'm doing the quality improvement project, which was a class I didn't necessarily enjoy or have any interest in. But there was something I wanted to do with eating disorders. And I realized, oh my gosh, I learned this framework like 100 years ago. What was it? And like, you never know when stuff is going to pop up and you are like benefiting tremendously, by exposing yourself and to all of these different things from all kinds of different other public health professionals, and it will pay off.
Thank you both. I feel like that those closeout statements are just very reassuring for myself and I'm sure for everybody else. Just to quickly close this out, because I know they just put a message, we have 5 minutes left. Again, on behalf of CUNY SPH and the Office of Career Services, just want to thank you all for attending. Want to thank our panelists so much. We hope it was insightful and encouraging. I'm sure you all feel that way. And we look forward to anybody who's going to join day 2 of the panel series tomorrow night. So again, please visit the Career Services website to learn more about resources available for CUNY SPH students and alumni. And I know there's only a couple minutes left, but I think after the breakout room closes out, staff will be in the main room for a few minutes if anybody has any like lingering questions. You'll also receive, I think I mentioned before, a post-event email on Friday with the panel recordings and a contact information sheet. So you could connect with Amelia and Veronica if you had any anything comes up in between now and then that you want to ask them or discuss with them. And I believe that when you guys leave the event tonight, you'll get a brief feedback survey that'll pop up. So just please make sure to fill that out. That's really helpful for the career services group with like future planning for events. So again, thank you all so much. I believe at this point you guys can move to a different breakout room, or it should probably be closing out back to the main room soon. But I'll stay on for the next few minutes if anybody has any last questions. But thank you all again so much for attending, and thank you again to Amelia and Veronica for sharing all the insightful information tonight.
Thank you.
Thank you.
Thank you.
Yeah, good luck to everyone. I think it's great that you show up to something like this, especially with all your classes. It shows like how committed you are to making sure your career works out the way you want it to be. It's great.
Thank you,
Bye.
Amelia.
It was nice to meet you guys too. Nice to meet you, Veronica.
Yeah,
And Brian and Julia.
Oh yeah, likewise, for sure.